In public? Yeah. Okay, so declare this meeting open. Welcome members to our 17th meeting of the Public Accounts Committee in this 2022-27 mandate. Advise the members that the committee meeting will be recorded and broadcast throughout Parliament buildings and online. However, there may be a slight delay when we're moving from any private session back into public session, so please be patient. I also advise the public gallery more than welcome to use mobile devices as long as they are in airplane mode and all devices are muted. They can connect to the Assembly Wi-Fi. Password details are available on the gallery rules, and it is not permitted to take any photographs or recording of this meeting. Welcome. So agenda item 1, apologies. Members, I just want to say a few words. Obviously our chair, Daniel McCrossan, MLA, is not here today. Just on behalf of everyone and our committee members and staff, I just want to express our deep condolences to Daniel and of course his wider family on the loss of his mother. I know he wished he could be here, but obviously he's struggling at the moment and we're all thinking about him and he's all in our thoughts. So I think if everybody would be happy, we're just going to send like a letter of condolence to Daniel on behalf of the committee if everybody's in agreement with that. Thank you. Agenda item 2 then. Drafts minutes. I refer members to the pack for a copy of the draft minutes of our meeting on the 27th of June. It's page 8. I'm just seeking agreement, members, for the minutes. Agreed. Agreed? Yeah. Thank you. Yeah. Agenda item 3 then, declarations of interest. Do any members have any relevant declaration of interest to declare for this meeting? Nope. Thank you. And then agenda item 4, matters arising. So if I have members, the responses have been received from the departments in response to the request sent to the COPs following the evidence session on public procurement in Northern Ireland. Responses are being reviewed and members, of course, will be briefed in the coming weeks. Are you content that this correspondence be forwarded to the Northern Ireland Audit Office and to be considered in the inquiry into public procurement in Northern Ireland? Yep, thank you. I refer members to pages 16 to 25 of the meeting pack for a correspondence dated the 5th of July 2024 from Dennis McMahon, Permanent Secretary and Accounting Officer of the Department of Infrastructure, providing information requested in response to the memorandum of reply on planning in Northern Ireland. Members, this letter provides a comprehensive answer to all our queries. I note that in respect of the fundamental review of the planning system, that this is ultimately a decision for the Minister, whose view it is that it is not warranted at this time. The Minister has instead requested that the IRPC draw up a programme of work to March 2025 with the aim of providing a solution-focused advice to support the Planning Improvement Programme. Our members content to note this response and forward it to the Infrastructure Committee for their information. Yep, thank you. And members, I refer you then to pages 26 to 29 of the meeting pack for correspondence dated the 15th of August 2024 from Colin Boyle, Permanent Secretary and Accounting Officer for the Department of Communities, in response to queries raised from the recent evidence session on child poverty in Northern Ireland. Members, again, are you content that this correspondence is forwarded to the Northern Ireland Audit Office to be considered in the inquiry into child poverty in Northern Ireland? Thank you. And again, I refer members to pages 29 to 53 of the meeting pack for correspondence dated the 16th and the 20th of August 2024 from Chris Quinn, Northern Ireland Commissioner for Children and Young People, providing further evidence following his recent attendance for the evidence session into child poverty in Northern Ireland. Again, are you happy that the correspondence is forwarded to the Northern Ireland Audit Office to be considered into the inquiry for child poverty in Northern Ireland? Thank you. Perfect. Agenda item 5 then, there is no chairperson's business. Agenda item 6, correspondence. So we have some more. I refer members to pages 54 to 61 of the meeting pack, where there is further written submission into our inquiry into child poverty in Northern Ireland, which raises issues in relation to child food insecurity, given of course the serious harm that it causes to children's health, well-being and long-term futures. Are you content to note this submission and again forward this for inclusion in our inquiry report? Members, in pages 62 of the meeting pack is a letter dated the 5th of September 2024 from Anne Watt of Pivotal, sharing their report on the first 7 months of the restored NI executive. Are you content to note this correspondence? Yeah. Refer members to pages 63 to 78 of the meeting pack, where there is a letter dated 13th of September 2024 from CNAG Dorina Carville regarding the issue of Northern Ireland Audit Office departmental guides. Again, are you happy to note this correspondence? Yeah. I don't think I've ever spoke this much before. Agenda item 7 then, memorandum of reply to mental health services in Northern Ireland. So I'm going to welcome to the meeting Mrs. Dorina Carville, Controller and Auditor General, Colette Kane, Director NIAO, Mr. Calgett Bingham, Assembly Support Officer NIAO. Members will refer you to the memorandum of reply on the mental health services in Northern Ireland at pages 80 to 94 of the pack. So I'm going to ask the clerk to give a brief update to the committee.
Okay. Thank you, Chair. Yes, this MOR then is in response to the committee's report into mental health services, which was published in June of this year. And the reply then came in August of this year. So it's a very positive response. The department has fully accepted 11 of the 16 recommendations made by the committee and partially accepted the other 5. What I do note is that the format has changed so that the targets are very clear, so that that's to be welcomed. And if you also note that the target dates, they're all like reasonably quick, considering there's quite a lot of work to do. One of the recommendations, the 7th one, says in terms of it, they're actually proposing an earlier date of December 2024, and that was in relation to greater engagement between the Department of Health and Child and Adolescent Mental Health Services to identify common areas and themes around failed referrals and any other barriers to accessing appropriate support. You note that there are some partial ones as well, but I think there's good reasons, sort of very comprehensive reasons as to why some of those are not fully accepted. So bearing that in mind, the committee may then want to consider when they would like an update, given most of the timescales are sort of June. It would seem appropriate then to be looking for an update probably in 12 months' time, which would be around now. But that's a matter for the committee.
Any thoughts, members? Would you be happy to go with the 12 months? Yes, go ahead, Diane.
Yeah, I just was a little bit concerned on their responses to the recommendations to 4 and 5 around the data. At the time of the report, it was very much, they were referring to whenever the mental health outcomes framework came into place, they would collect data better. But the fact that things have been live for a number of years, and we're now in September and we're going to get an update on June 2025, I'm just really concerned about how we're collecting data on this right now. And especially number 5, our recommendation says this should be commenced now, so that it will be completed whenever Encompass is fully rolled out. Now I know they're saying they're partially accepting and fully accepting it, but whenever you actually read the detail, I just am a little bit concerned as to what's happening right now with the data collection. So I don't really know, happy to take advice on it, but it was something that we did feel quite strongly about.
Yeah. You could always write to the department and ask to be kept up to date on the data collection and the rollout of Encompass more regularly than this suggests. So if you did want that, or if you did want to question it further with the committee, with the members, it's really up to yourself. But they have explained, and I appreciate your concerns. So maybe seeking an earlier update on those 2 in particular.
I think Chair, it wasn't so much the update on the rollout of Encompass, it's them updating right now on what they're collecting and reporting on their data on mental health services as it's currently being delivered right now in 24-25. because yes, the outcomes framework will be the answer at the end of it, but the issue was they were telling us in the hearing that they had all this data, but it wasn't really being presented or compared anywhere quite meaningfully. So I just appreciate the detail of all of these, but I just would be concerned within it and as an aside as to what's actually happening right now this year when they're continuing to spend 300 million on mental health services and continuing not to measure and report outcomes. That just would be my concern on it right now.
Chair, just to say they have actually noted in recommendation 5 that they were establishing this regional mental health service, which would have like a business unit within it. So we could maybe write and see what or ask the question as to what they're doing and what their intention is around the data that is in existence at the minute. Perhaps.
Would you be happy if we?
Yeah, sure. Like I'm happy to hear what the rest of the committee thinks to it, but I just felt like I wanted to just express it was something we were very concerned from with the question, and that nobody seemed able to answer what's happening right now for the money that's being spent and what's being measured. And like, happy to take any approach, but I think that it is a huge issue right now, and we need to make sure that the money being spent this year is reported on.
Is there any other thoughts on that, members, or would you be happy enough to go with that recommendation? Yes, go ahead, Patrick.
Thanks, Chair. No, I just totally agree with Diane's points. I mean, no, point 5 was one that jumped out to me as well. I suppose there's two things on there for me. We're looking at quantifiable data, but I think we need to look at qualitative data as well. So I think we need both. But the other thing for me is, while I'm happy with a 12-month time frame, I suppose to have a firm answer. I would share the concerns of other members around that as being quite a long time frame. I would be thinking that we would be better to have quarterly updates to ensure that there is continuous progress. So while ultimately we might be working towards a 12-month time frame, I don't see why we couldn't have updates in the interim until we get to that point. So just really to put that forward to see if other members agree. I just think that it's important that we ensure and monitor the progress as we go on this, rather than get the 12-month time frame and perhaps the recommendations aren't what we thought or where we thought we were going to be at that point. So I think we should monitor it as it goes.
Thank you, Patrick. Is there any other comments on this one? So what I'm taking from that then, we are happy with the 12-month time frame. However, if we had quarterly updates to kind of keep us abreast of what's going on and everything's progressing as it should be. And then in terms of the data collection, then if we can write and ask exactly what is being done in the here and now, so we have kind of a baseline for moving forward then, would everyone be happy with that?
Yeah, absolutely.
Yep. No worries. So is there any other comments just from anyone else in the committee about that before we move to yourselves? No? Obviously, CNIG, if you want to make any comments.
No, I'm content. Colette, do you want to comment?
I suppose a lot of them you'll see they are caveated by the funding issue, but that was to be expected. And I suppose particularly around the workforce implementation plan and the rollout of that is probably one of the ones that have a longer time frame on it. Yeah.
And again, members, is there any other comments, or are we all happy? We'll take those 3 actions forward then, and we'll stay abreast of them. Yep. Super. Thank you, members. So agenda item 8 then, which is our inquiry on child poverty in Northern Ireland. So this is an issues paper. So I think, is there a change at the top?
Present some research. No, please.
Research. Welcome to the committee. So just want to welcome Aoife Keating Fitzpatrick from the Assembly Information and Research Service. You're very welcome. So members, at pages 96 to 109 of your pack is a briefing paper prepared by RAISE on child poverty strategies in Scotland and New Zealand. So this was actually commissioned over recess by the committee. So you've obviously took a lot of time and effort, and really appreciate that. So members, just even if you want to give a brief update, and then we'll take some questions from the members on the report. Is okay?
Sure, absolutely.
Thank you.
Yes, so as you said, my name is Aoife, and I recently joined the Assembly's Research and Information Service. So many thanks for inviting me along today to talk you through this brief on child poverty strategies of Scotland and New Zealand. So first, I'm just going to talk you through some of the successes of each strategy and how they might be transferable to a Northern Ireland context, and then also how elements of each strategy aligns with the recommendations of the Audit Office report. And then second, I'm just going to draw out a few areas for kind of caution relating to each strategy. So looking at Scotland first, Scotland's 2022 to 2026 strategy is titled the Best Start, Bright Future Strategy, and is developed in response to the Child Poverty Scotland Act 2017. The strategy set a target to reduce relative poverty to 10% by 2030, with an interim target for 2023-24 of 18%. And then there are additional targets for absolute poverty, material deprivation, and persistent poverty, which you'll find on page 5. Scotland will either have met or missed those targets by now, but the data won't be released until March of next year. However, with that said, based on the data that we do have, it seems very unlikely that they will have reached their targets based on the 2022 to 23 figures that you can see on page 8. Despite the likelihood these interim targets have been missed, the Scottish strategy has been commended by the Audit Office report and other commentators for its structure, its clear targets, measurable indicators, and its monitoring and accountability mechanisms. There's evidence of a collaborative approach across government departments and other relevant stakeholders to actioning the strategy, and independent scrutiny is given by the Poverty and Inequality Commission. The strategy's approach to poverty reduction has focused heavily on certain family types, which are considered to be most vulnerable to poverty, including lone parent households and minority ethnic families. These family types would also be considered to be the most vulnerable to poverty in Northern Ireland as well. So beyond the strategy itself, the Scottish Government has been consistent in prioritising child poverty reduction as a key aim of its programme for government. Not dissimilarly to Scotland, New Zealand, especially under the previous Labour government, has repeatedly made eradicating child poverty a central ambition of its programme for government. New Zealand's Child and Youth Wellbeing Strategy is an open-ended strategy which sets 10-year targets as well as 3-year interim targets. And the strategy was developed in response to the Child Poverty Reduction Act 2018 and was initially driven by the Department for Prime Minister and Cabinet, with Prime Minister Ardern taking on the additional role of Minister for Child Poverty Reduction. And she stated at that time that the New Zealand's ambition was to become the best performing country for children. Not unlike Northern Ireland's 2016 strategy, the New Zealand strategy focuses on several high-level outcomes, such as children having what they need. However, unlike the Northern Irish strategy, there is a legal requirement for each high-level outcome to be measured through a monitoring system of 36 indicators around areas such as housing affordability, housing quality, food security, regular school attendance, and potentially avoidable hospitalisations. New Zealand's 10-year longer-term targets aims to first reduce the proportion of children in low-income households on a before housing costs primary measure from 16.5% of children to 5%, which is a reduction of around 120,000 children. Second, reduce the proportion of children in low-income households on the after housing costs primary measure from 22.8% to 10%, which is a reduction of around 130,000 children. And then third, reduce the proportion of children living in material hardship from 13.3% to 6%, which is a reduction of around 80,000 children. So by 2023-24, the government had interim targets to reduce the proportion of children in low-income households on the before housing costs measure to 10%, low-income households on the after housing costs measure to 15%, and material hardship to 9%. Whilst the strategy saw an initial reduction in child poverty figures, in recent years this trend has reversed, with New Zealand looking as though they'll also miss their interim targets. So the most recent data shows poverty at 12% on the first measure, 15.4% on the second measure, and 10.3% on the third measure. Despite this plateau in child poverty reduction, the New Zealand strategy has been commended not just for the clarity and ambition of its targets, but also for its inclusive co-design approach, most notably with children living in poverty themselves, and also for its continuous engagement with a broad set of stakeholders, including Maori and iwi groups. The strategy has also been commended by the likes of the OECD for its annual reporting mechanisms and the inclusion of child wellbeing priority areas in the government's budgeting efforts, which links back to the strategy. So officials on the ground have said this makes integration of the strategy into policy development far easier. So hopefully that overview gives you a sense of both strategies, and I just wanted to pull out a few areas where these countries are doing kind of what they're doing in practice aligns with the 8 recommendations of the Audit Office report. So in short, recommendations 1 and 2 focus on the need for an integrated cross-departmental anti-poverty strategy with a coordinating department as lead. Scotland's strategy is a really good example of a clearly structured, well-integrated and collaborative approach to tackling child poverty, whilst New Zealand has shown how such a strategy can be led from the top through a coordinating mechanism such as the Department for Prime Minister and Cabinet, and how integration in the budgeting process can be helpful. Though it must be noted that in New Zealand, child poverty reduction as a policy area has recently been moved to the Ministry of Social Development under the new government. Recommendations 3 and 6 centre around the collective ownership, accountability and monitoring mechanisms, in addition to the legislation that underpins both strategies and the targets set by both countries. In Scotland, monitoring is primarily achieved through that Poverty and Inequality Commission, whilst in New Zealand this is done through the annual reporting to Parliament. Recommendations 4, 5 and 8 focus on collaborative cross-departmental working on properly costed actions as well as inclusive co-design of policy interventions. And by prioritising child poverty reduction in their programmes for government, both Scotland and New Zealand have been able to foster a culture across government whereby tackling child poverty is considered a collective goal worthy of prioritised budget allocation. And then finally, recommendation 7 considers the need for a new poverty measure. And both Scotland and New Zealand measure and set targets for relative poverty, absolute poverty, material deprivation, and also poverty persistence, which gives more accurate and nuanced insights into what poverty actually looks like over a longer time period. So they also look at depth of poverty and the poverty gap, which further eliminates the actual extent and reality of poverty in their societies. So whilst there are potentially many learnings that could be taken away from the strategies of both Scotland and New Zealand, it is also important to note that both countries appear to have missed their interim targets and are on course to miss their longer term targets as well. Challenges such as the pandemic and the more recent cost of living crisis are undoubtedly factors here, but commentators have also questioned some of the substance and or the approach of each strategy. So to sum up, this report is quite a brief look at the strategies of Scotland and New Zealand. However, both countries are due to publish interim progress reports in 2025, and it'll be interesting to see the most recent data on their respective interim targets and the evaluative reports that will no doubt follow. So many thanks.
Thank you so much. That's a fantastic piece of work, and I think I can speak on behalf of the committee. We really appreciate the time and effort that you've put into that and the level of detail as well. I suppose just 2 of the wee things that I've taken from that. The co-design element and the co-design kind of method of best practice, is there anything that you've pulled from either Scotland or New Zealand where you see that has worked extremely well? And I just take back to one of our inquiries where we did look at co-design and there was maybe issues there in terms of communication and things. You know, is there a method of best practice that you've seen within that research that we could take and utilise here in Northern Ireland?
Well, I think one of the real things that came out of the New Zealand strategy in particular was the fact that they have regularly consulted children. So that was really part of their co-design from the very start. And not just that, but they have these, because they've got 3-year kind of rolling interim target periods. Every time that 3-year period comes back around, they consult children again. And those children, they often target, or they often kind of canvass for particular groups of children that kind of fit into some of those priority family types I mentioned that are most vulnerable to poverty. And as well then as children, they obviously focus their co-design policies with the likes of community groups, including Maori communities and other kind of maybe more disadvantaged and potentially more vulnerable to poverty communities.
Appreciate that. And just in terms of the priority family types, you know, lone parents, minority, ethnic, households with more children or disabled children and everything, there's obviously a barrier to employment with that. Is there anything that you've seen within your work that can reduce those barriers or blow those barriers away, basically, to allow people support and assistance to get into work, even with the situation that they maybe have at home?
Well, there's probably more that could be looked into, probably around childcare in particular, and I think that's another area that both Scotland and New Zealand have definitely prioritised, and certainly those were two areas that at the beginning of each strategy, so 2017 and 18 respectively, that was something that got an initial like kind of huge funding intervention, and something that they've continued to kind of prioritise.
Support as well. No, I appreciate that. Thank you very much. Cathal, you're up.
Thank you, Chair. Eva, thanks very much for the paper and the presentation. Just two areas I want to concentrate on, and obviously cross-reference to the recommendations coming out of the audit office. Two things, I mean, I may have heard you wrong here. The two things I want to talk about is silo mentality, and the other obviously is funding. So let's take the two models, and I mean, they seem to be good enough practice, is best practice, right? I'm not saying it's the panacea, but it's a good start. So just identify what you said again in terms of who originally led the Scottish model and how they got away with this silo mentality and working collaboratively, you know, to get everybody together, said this, folks, this, rather than a legislative change to hold or combine everybody together. You know, could you articulate a wee bit more on this, that? And also, you said, now I'm wrong, or maybe be corrected here, that the New Zealand model was led from the top first and now it's transferred back to the Minister. So just on those 2 points and what we can learn, and then I take it then that there had to be a budget attached to both of them, whereas we are here in the case we're fighting with the health budget or whatever budget of whatever is communities, whoever's responsibility to take the budget off them. So just a wee bit on what you've learned from that and what we can learn going forward ourselves. Thank you.
So I think with Scotland, what's kind of clear from their strategy is they very much kind of started out with almost like the strategy first, and then everything had to kind of, any interventions came from there rather than the other way around, where we already had an awful lot of interventions across different departments and then they kind of fed into the strategy. And then I think with Scotland, they've kind of consistently made eradicating, tackling child poverty a huge part of their programme for government. So it's kind of gone beyond the strategy, if you like. And I think by giving it that kind of prioritisation, giving it really kind of the strategy really clear targets, it's really kind of focused the minds, or appears to anyway, have really focused the minds across departments, which has really kind of helped them build collaborative working. And then in terms of New Zealand, I think it's a bit speculative, but I suppose it appears that change from moving the Child Poverty Reduction Task Force from the Department for Prime Minister and Cabinet to the Ministry for Social Development is probably just because the government's changed. So whilst Jacinda Ardern, like, she got into politics because of her commitment to reducing child poverty, it's now there's another government there in New Zealand, and that's changed. But it also could potentially be because you know, it was good for it to have been given that prioritisation originally, and now, you know, 6 years on, you know, the kind of the reins have been handed over. So yes, and then I think in terms of funding as well, I think New Zealand is an interesting case because they've kind of included this kind of focus in their budgeting efforts. So again, by kind of putting that mechanism into that budgeting process, it means that it's kind of fostered this mentality across departments that whenever they're looking at their individual budgets, they have to kind of consider the the child poverty strategy.
Thank you. Thanks, Chair.
Thank you. Colin?
Yeah, and I've slightly lost the thread of it, but I think I'm right enough in the numbers, but it mentions about having the right people in the room, and I suppose there are many of the right people, and certainly the sectors and all those people with that experience, but people who are experts by experience themselves, so young people in particular. I think it refers to 31 haven't been spoken to. I wonder, is that sufficient to get a range of experiences and kind of, you know, the depth of qualitative feedback that you'd want to get. What do you think on that?
So I think you're referring to the New Zealand strategy there. So
Yeah.
it was originally they consulted 6,000 children, and then 420 of those had been identified as living in poverty, and then other children within that kind of 6,000 bracket had different experiences of, different kind of life backgrounds, basically, some of which would have fit into those family categories, even though they weren't necessarily experiencing poverty at that time. So I'm not entirely sure if that's the same number that they consult every 3 years at the interim periods to kind of check in the strategy, but they have got that ongoing consultative requirement, basically, with children.
In general, do you think that the more perspectives from that point of view you have in these types of issues, the better that the learning?
Presumably, I mean, I haven't seen kind of a breakdown necessarily of exactly who fits into that number, but I think from the evidence that I've seen, there hasn't been any kind of criticisms that it wasn't enough or it wasn't sufficient.
Thank you very much. Is there any other comments from members?
Oh, sorry, Patrick. Yes, go ahead.
No problem. Look, thanks very much for your presentation. And it's really just to probe a wee bit more on the Column's point as well. I suppose the 6,000 and the 31 comparative numbers were two that jumped out at me. One of the things I found interesting within that was the breadth of experience as well. And we know now, like with cost of living, with other financial pressures that family are under, that the number of people, and I suppose the definition of poverty has broadened out significantly. Like I was a teacher before I came into this role, and I know from a number of families who, in some circumstances, the two parents working, we're struggling as well, and that's becoming increasingly an issue. So in terms of that, I suppose for me, and this part's more a comment, but it's more about continuously assessing that, because I think we need to assess it against ongoing and changing trends rather than against, I suppose, a set model, which kind of leads me on to my question, really, about the outcomes-based accountability. There's mention of that, and I suppose looking, I always ask in this committee a lot about data, but it's so important in understanding where we're coming from and getting that broad perspective. The definition for me of how we're defining better off and how we're actually gathering that qualitative data is so important, because our definition of improvement of being better off is so important. And I don't know if you had any experience from either looking at the Scottish or New Zealand model that you think would help us in doing that, because I'm conscious it's not just about looking at numbers. Like, we're talking about people's lives, we're talking about people who are struggling in many aspects, and actually how we as a government can help to improve their lives. So while looking at the numbers is obviously important, there's the real human side to it, and there's understanding those experiences and those stories. And I just wanted to get a better sense of how we can do that and actually allow that to inform policy.
Yeah, so I think with both strategies, I mentioned they both look at relative poverty, absolute poverty, material deprivation, and also poverty persistence. I think that last point is potentially kind of relevant to what you've said, in particular, poverty persistence, because it shows, it's not just a snapshot view of how people are kind of coping in that 1 year, that one time, and it gives you kind of a broader sense, basically, of how society actually looks like. So, and I think they also then look at poverty depth. So if people are dropping below that poverty line, how far are we talking, and how, the depth of poverty, basically. And then I think with Scotland, they've got that mechanism for monitoring through the Poverty and Inequality Commission. And through that, it's not just their reports that you kind of get a real sense of ongoing progress with the strategy, but also the fact that it's there, it gives academics more opportunity to comment, it gives journalists more opportunity to comment. And similarly with New Zealand, whilst their model is more that annual reports get sent to Parliament, because they are annual and because they've kind of got this open-ended 3-year rolling interim targets system in place, again, it means that it's how they're progressing with their strategy is much more open and kind of, if they're hitting their targets, if they're missing their targets, then questions can be asked, and that's in a more rolling kind of base.
No, that's interesting. I think it's that ongoing accountability as we continuously talk about in this committee. So look, thanks very much for your answer. Thank you.
Really appreciate that. Is there any other comments? I just want to say thank you so much. That was a really, really beneficial piece of work, and I think it'll have really useful for our inquiry going forward. So again, thank you. I think we'll all appreciate it. So members, are you happy if the content of this report is published on the Child Poverty Inquiry pages on the NI Assembly website? Yep.
Yes.
Great, thank you. Really appreciate it. Thank you. Members, we're now going to move into closed session. So.